High blood pressure, hypertension. Overview. High blood pressure is a common condition in which the long term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. You can have high blood pressure, hypertension for years without any symptoms, even without symptoms, damage to blood vessels and your heart continuous and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems including heart attack and stroke. High blood pressure generally develops over many years and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctor to control it. Symptoms. Most people with high blood pressure have no sign or symptoms even if blood pressure readings reach dangerously high level. A few people with high blood pressure may have headache, shortness of breath or nosebleeds, but these signs and symptoms are not specific and usually don't occur until high blood pressure has reached a severe or life threatening stage. When to see a doctor? You will likely have your blood pressure taken as part of a routine doctor's appointment. Ask your doctor for a blood pressure reading at least every 2 years, starting at age 18. If you are age 40 or older, you are 18 to 39 with a high risk of high blood pressure. Ask your doctor for a blood pressure reading every year. Blood pressure generally should be checked in both arms to determine if there is difference. It is important to use an appropriate sized arm cuff. Your doctor will likely recommend more frequent reading if you have already been diagnosed with high blood pressure or have other risk factors for cardiovascular disease. Children aged 3 and older will usually have blood pressure measured as a part of their yearly checkups. If you don't regularly see your doctor, you may be able to get a free blood pressure screening at a health resource fair or other location in your community. You can also find machines in some stores that will measure your blood pressure for free. Public blood pressure machines, such as those found in pharmacies, may provide helpful information about your blood pressure, but they may have some limitation. The accuracy of these machines depends on several factors, such as a correct cup size and proper use of the machine. Ask your doctor for advice on using public blood pressure machine. Cause there are two types of high blood pressures. Primary essential hypertension. For most adults, there's no in identifiable cause of high blood pressure. This type of high blood pressure, called primary essential hypertension, tends to develop gradually over many years. Secondary hypertension. Some people have a high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal glands tumors, thyroid problems. Certain defects you are born with, congenital in blood vessel. Certain medications such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs. Illegal drugs such as cocaine and amphetamines. Risk factor. High blood pressure has many risk factors, including age. The risk of high blood pressure increases as you age until about age 64. High blood pressure is more common in men. Women are more likely to develop high blood pressures after age 65, whereas high blood pressure is particularly common among peoples of African heritage, often developing at an earlier age than it does in whites. Serious complications such as stroke, heart attack, and kidney failure also are more common in people of African heritage. Family history. High blood pressure tends to run in families. Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrition to your tissue. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. Using tobacco. Not only does smoking or chewing tobacco immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke also can increase your heart disease risk. Too much sodium in your diet. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. Drinking too much alcohol. Over time, heavy drinking can damage your heart. Having more than one drink a day for women and more than two drinks a day for men may affect your blood pressure. If you drink alcohol, do so in moderation. So, for healthy adults, that means up to one drink a day for women and two drinks a day for men. One drink equal 12 ounce of beer, 5 ounce of wine, or 1.5 ounce of 80 proof liquor. Stress. High level of stress can lead to a temporary increase in blood pressure. If you try to relax by eating more, using tobacco, or drinking alcohol, you may only increase problems with high blood pressure. Certain chronic conditions. Certain chronic conditions also may increase your risk of high blood pressure, such as kidney disease, diabetes, and sleep apnea. Sometimes pregnancy contributes to high blood pressure as well. Although high blood pressure is most common in adults, children may be at risk too. For some children, high blood pressure is caused by problems with their kidney or heart. But for a growing number of kids, poor lifestyle habits such as an unhealthy diet, obesity, and lack of exercise contribute to high blood pressure. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as organs in your body. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke. High blood pressure can cause heart denting and thinning of the arteries, which can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to thicken. Left ventricular hypertrophy. Eventually, the thickened muscles may have a hard time pumping enough blood to meet your body needs, which can lead to heart failure. Weakened and narrowed blood vessels in your kidney. This can prevent these organs from functioning normally. Thickened, narrowed, or torn blood vessels in the eyes. This can result in vision loss. Metabolic syndrome. This syndrome is cluster of disorders of your body's metabolism, including increased waist circumference, high triglycerides, low high density lipoprotein, cholesterol, the good cholesterol, high blood pressure, and high insulin levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. Trouble with memory or understanding. Uncontrolled high blood pressure may also affect your ability to think, remember, and learn. Trouble with memory or understanding concept is more common in people with high blood pressures. Dementia. Narrowed or blocked arteries can limit blood flow to the brain, leading to certain types of dementia. Vascular dementia, a stroke that interrupts blood flow to the brain, also can cause vascular dementia. Treatments option for high blood pressure. A number of factors help your doctor determine the best treatment option for you. These factors include which type of hypertension you have and what cause have been identified. So in our next video we are going to discuss about the treatment of hypertension or blood pressure. So for that time stay with us and stay healthy.